Welcome to the Nutrimedical Report, where we bring you the best guests, the best experts in the world, and the best solutions. And we do not cut any slack. We do not take any prisoners with the truth. We expose you to the very bare facts. And then, like a surgeon, such as our surgeon that's going to be on next, neurosurgeon, Dr. Russell Blaylock, and CCN top functional medicine doctor, probably one of the top doctors on the planet. And we're going to discuss the national health insurance and, of course, the fact that these town hall meetings are being taken up by so much fury and smoke dealing with these issues. A lot of what Obama wanted he already has. So we have one of the slickest liars in history, one of the most evil takeovers of health care, and one of the most destructive things to one of the best systems. There are both good and bad in our current system. But the good will die with the bad, and this system that they're trying to put in place is not for the betterment of the American population, not for improving health access or care, not for improving the wellness of the population, but for control and for survival of large hospital networks, for HMOs, horribly mangling organizations, I call it like the blender for health care. And Dr. Russell Blaylock, from his own personal experience and analysis, having read the bill, not making conjectures based on nonsense but on fact, has written this 22-page paper you can actually upload for the link on more information at the bottom of today's show. So without ado, we're going to have on one of our best guests ever, often requested back regularly, National Health Insurance, the Socialist Nightmare, by Dr. Russell Blaylock. Welcome back, Dr. Blaylock.
Thank you, Bill. I appreciate it.
Well, your brilliant mind is cutting through just like a surgeon's scalpel this foolishness and this obscene lies and the smoke and mirrors and the tactics that are going on by some of the slickest neurolinguistic programming and posing that's going on with these public forums. It's just ridiculous.
Well, it is, and you know, these people are absolute experts at propaganda and manipulation of people's access to this truth and to media. And they're being fed a regular diet of lies through the major media. For instance, when I hear them say, well, there's nothing about abortion in that bill, and the right wing who says so is just lying. Well, anyone who's read the bill, it's right there, but they do not ever use the word abortion because they knew the response it would have. But there is a 2 or 3 page section that's just on family planning. Well, all family planning includes as an option abortion.
Right.
And, of course, the family planning, as according to the bill, is to be directed at the poor neighborhoods. Now, this should scare all the people who live in the poor neighborhoods because they're going to be targeted. It also has provision for a national health corps, which says that, this is supposed to be a draftable thing where they'll draft the young people into a health corps, into a national corps, but you could opt for the National Health Corps, in which you will be trained for various functions of the health corps, for instance, giving out vaccines or giving out literature on end-of-life counseling. They also have a provision in there on school-based health clinics. Well, if you've read any of the literature on the discussion about school-based health clinics, it's terrifying because it takes many decisions away from parents. They go into the health clinic, they give them condoms, they give them birth control pills, they give them advice on their sexual behavior, all without any parental consent whatsoever. And this is expanded to include also, according to it, mental health program. And I read directly from the bill, this will include mental health assessments, crisis intervention, counseling, treatment, and referral to services including emergency psychiatric care, community support programs, inpatient care, and outpatient programs. The scary thing in that wording is treatment, that it will include treatment. Now, this is treatment at a school, not at a doctor's office, not at a psychiatric facility, not with knowledge and permission of the parents. Your child, according to this bill, it is the discretion of the Director of the Health and Human Services how this will be done. Now, what's scary about this bill is so many parts in it the discretion of everything is left up to the Secretary of Health and Human Services. In fact, future evolving aspects of the plan are left up to the director of HHS. That it will evolve once it's approved. So you don't even know what's in it from reading it, because multiple sections say that this will be worked out after approval of the bill, even years after it's been approved. All of it under the discretion of the Director of Health and Human Services. It also is inclusive for all medical education. In other words, the federal government will take over medical education in a stepwise manner. There'll be approved medical schools. All this is written in there. And that medical students will be trained according to federal guidelines, which, of course, will include the social engineering that they're promoting. And that, of course, will include encouraging end-of-life counseling as well as abortions. You can just guarantee yourself of that. This is the most all-inclusive takeover of health care and goes beyond health care. It will be enormously expensive. They talk about the massive amount of paperwork that will be required. Everything will have to be documented by every physician, everything he does. Doctors will never be able to take a vacation again. Every moment they have will be filling out documentation to satisfy the government, which is unending, and all that's in the bill. This is a nightmare.
And the consequences, of course, Dr. Blaylock, are grisly, to say the least. Can you tell us about the consequences of doctors that even inadvertently file a wrong paper, without intention to file a statement or a bill, whatever, that is deemed, quote, a violation of one of the gargantuan regulations? It's going to be a nightmare of selective prosecutions and a Damocles sword and an electronic medical record choke chain around the doctor's neck, any health professional, nurses. It's going to be absolutely nightmarish.
Well, it already is. If you look at Medicare law now, Medicaid law, it says that if you violate any of the statutes of the Medicare and Medicaid law, even inadvertently, in other words, they don't have to prove intent that you were trying to defraud the system or do anything wrong. It does not even require any intent. Just inadvertently overlooking one of these laws, you will be punished as if you did it on purpose.
And not only that, I dropped Medicare years ago because even if you saw someone for free, because it was easier for me to not go through all the billing stuff, just to say, hey, it's just free today. Just come on in and I'll take care of you. I'll even supply the bandages and the sutures and do whatever I got to do for you. And guess what? That doesn't get you off the hook either, because even if you supply free care and you violate their regulations, you're going to the big house.
Well, it's against the law to supply free care.
I know that. That's why I stopped even seeing these people.
Statutes, you cannot give away medical care for free to a federally sponsored patient.
Right.
So that's against the law. And, of course, the health insurance companies have followed virtually everything that the federal government does in terms of regulations and rationing. And so they followed suit, and they do the same thing. We used to do insurance only, where the insurance would cover everything. It would be no out-of-pocket cost if you thought the person was on hard times. That became against the law.
Yeah, because I remember years ago, I worked in a clinic in Georgia, and we would have a half a day to a day a week where we just have people come in free and just come on in. We'll check your blood pressures. We'll even get samples of pills for you. We'll take care of your health needs, your blood pressure. We'll examine you. At our own expense, we would do all kinds of things, even sending off blood tests. And the doctors would do it because we would make enough. We said, well, we can provide this service to the public. But not anymore. No, sir. The choke chain is on. And it's bad enough now, but under Obamacare, it's Nazi care on steroids. Back in a moment with more analysis by Dr. Blaylock, not conjecture, having read the bill. Dr. Blaylock's 22-page paper is available for you to upload now. Welcome back, and when you read this paper, it's heart-wrenching, Dr. Blaylock, all the stories that you give here. And these are real situations. We're talking about young eye surgeons saving people's vision and going to prison for, quote, abusing a Medicare patient because he helped that person get vision. turned in by a competing ophthalmologist. This is the kind of foolishness that goes on. This is the evil that goes on. And under Obamacare, it is going to be magnificently evil beyond the darkest imaginings of the most hellish future you can think of. And Obama is pimping us into this, trying to have a dialogue about, and many parts of it are already passed, including the electronic medical record. And, of course, I think you mentioned this, the Hastings Institute or Death Institute member, we call him Easy Kill manually. Dr. Easy Kill is now the, quote, health czar, crafting a lot of these new regulations. Can you talk about that for a moment?
Well, yeah, there's a couple of aspects to what you've said. One is in this relief package, this stimulus package, they snuck in the electronic data for medical offices, where all doctors would be required to have electronic systems in their office connected to the federal government, and all of them be accessible, including hospitals, nursing homes, etc.
Yeah, just like the song Sting. Every move you make, every keystroke you make, every statement you make to the nurse or doctor.
Everything that's in your medical record, private things you told your doctor are going to be accessible by the federal government.
Yeah.
Now, also in that the public is not aware of is that it includes physicians' protocols for treatment, which is ongoing. It can change constantly. And by, they said, 2014, there will be penalties attached to it if physicians don't carry it out. Well, this actually covers almost all the rationing aspect of this bill that supposedly is going down. If this bill completely disappeared, this gives the government absolute power over your health care and maximum rationing, because it says protocols will be, treatment protocols will be established for the physician. Well, which says to the physician, a person comes in age 55 and needs hip replacement, he looks on the protocols as people over 55 cannot have hip replacement. They'll have to have this alternative treatment, a four-poster walker or a cane. If he defies that and operates on the man's hip anyway, he goes to prison. For instance, as they do in England, over age 65, you're not allowed to do bypass surgery or other things to save people's heart or prevent a stroke. Well, that's the population that's mostly having strokes and heart attacks, but it's now against the law to do these life-saving procedures. If you violate that protocol, you go to jail, lose your license, etc.
Exactly, yeah.
So
Wonderful.
He already has in place what he needs, and that's why even if this bill disappeared tomorrow, he's taken over effectively all health care, and he can do this rationing that'll endanger the elderly population. Now, you mentioned the Hastings Institute. A lot of people don't remember the Hastings Institute. But back about 15, 20 years ago, there was a lot of clamor about euthanizing the elderly, going through nursing homes and hospitals and picking out people whose lives weren't worth extending, and just in a very humane way put them to sleep, as you would a dog. Ezekiel Manuel is a member of the Hastings Institute. He's a fellow. And he writes for them, and he wrote a couple of papers for them. One of them is very telling, in which he explains in philosophical terms what he intends to do. But being a member of the Hastings Institute, he agrees with their philosophy, and the president of the Hastings Institute wrote a paper that's very telling called Medical Progress, Unintended Consequences. And he talks about the elderly. He said they consume most of the health care dollar. And he said one could make a good case that improvement in education and job creation could be a better use of limited funds than better medical care. Social and economic progress may be the kind we most need, and the kind of progress would have doubled and even tripled benefits beyond improved health. In other words, why waste money on these elderly people who are consuming 50% of the health care dollar when it could better be used for our other social engineering projects? He goes on to say, patients must now learn with medical help how to live with and probably die with their condition by care-oriented medicine. I mean, not just good palliative care, but well-coordinated medical assistance to manage disease, further coordinated with social and family health. In other words, this is end-of-life counseling. Tell them, well, medicine cannot help you, but will help you die. And he goes on more explicitly and says, in the end, sickness and death can be forestalled but not conquered, the cost deferred but not eliminated. The public, must be made clear to the public that high-cost technologies will be severely limited when the final illness arrives. The carrot is that the prevention will give us a longer life. The stick will be the message that you should take care of yourself and not expect medicine to save you when your time runs out. That is no longer an option. In other words, when you get old and something happens, don't expect to have medical care assistance. Fifth, Americans already live on the average a long life of 77 years. There is no need to go out of our way to chase life extension or the denial of death as a sine qua non of medical progress. Well, their plan includes people age 55. For instance, in Britain, they refused to do a hip replacement on a man because they told him, quote, he was too old at age 55. And finally, he ends it by saying, serious progress would mean turning back the clock, learning to take care of ourselves, to tolerate some degree of discomfort, and to accept the reality of aging and death, not to mention the near-death experience of erectile dysfunction. I guess he thought that was funny. But the important thing is, never have you ever heard a liberal say that we can turn back the clock. It's always their mantra. We always have to move forward. But here's a liberal program saying we have to turn back the clock. Well, if we look at recent history, there's a lot of turning back the clock in the liberal program.
Right.
For instance, when there was mass inflation, they just told us under Jimmy Carter, we're all just going to have to learn to live simpler lives, ride bicycles, use a wood stove. We're just going to have to be simpler. There'll be no more progress in America. I don't know if you remember that, but that was the mantra in all the media and all the news programs. And then Ronald Reagan came along and said, no, the free enterprise system is based on expansion of the economy.
Right.
And all of that disappeared. But we hear this repeatedly from them that, oh, we just have to learn to live simpler lives and go back to a more primitive time. Now, they sell themselves as progressives. How progressive is it to say you just have to realize medicine can't save your life, particularly you older people? We're wasting valuable resources on trying to attain that goal.
Yeah, that's really evil. And it's also wrong-headed because medicine's going in the opposite direction for a long time, and we're making major leaps on neurosurgery, stem cell therapy, and many others to not only slow aging, but in many cases reverse a lot of the components. Back in a moment with more with Russell Blaylock. Unbelievable.
Heart-related health problems.
Welcome back to the Nutrimedical Report, and if you have your own analysis, if you have questions, call in to 800-259-5791. This paper needs to be distributed to all of your so-called congressmen and senators who voted, probably didn't even read the attached health bill, the electronic records. Now these town hall meetings are going on, and as you said, Dr. Blaylock, even if they don't get any more things in their so-called health bill or the other pieces of the bill they want to put through, they already have enough with the electronic record and these regulations to shove in a total eugenics, total matrix control, total choke chain on doctors, literally ripping the heart out of the doctors so that they can't practice compassionate medicine, advanced medicine, life extension medicine, medicine and treatment that restores function and vision and mobility to the elderly or to people that have serious injury or problems. No, they want a Nazi-style system on steroids. This would make Dr. Mengele smile in his fiery grave in the ninth ring of Hades. This is so evil, it makes my stomach turn over.
Well, your description is accurate. You know, one of the things I frequently deal with in talking about this is I get Medicare patients who call and they're all upset that I said these things, that they like their Medicare and it works smoothly. And what they don't realize is what their physician goes through just to get the simplest thing done for them. In other words, if you're going to admit the patient and do a certain procedure, he has to jump through so many hoops, call so many bureaucratic organizations, fill out so much paperwork, all of which are filled with penalties if he makes an error. The coding nightmare he has to go through. The patient never knows all that the physician goes through to get these things done. To them, it's just they walked in, they got treated, and they got well, and they're happy. Now, what they don't realize is that the federal government realizes it's going bankrupt. You know, Medicare and Medicaid are in severe financial difficulty, and they're going to step up the rationing. So some of these things that they got before are no longer going to be available. And in his paper that Ezekiel Emanuel wrote, he even admits, he says, quote, Medicare beneficiaries receive fewer services with some discretionary services covered and some services that intuitively seem basic or uncovered. Medicaid beneficiaries and uninsured persons receive far fewer services. So they're not getting near what they think they're getting, but the physician really has to go through a living hell just to practice medicine with Medicare and Medicaid patients. It's so bad in the state of Massachusetts, doctors were dropping out in droves. Massachusetts just passed a law said if a doctor does not see Medicare or Medicaid patients, he cannot have a license to practice.
Oh, you're kidding.
Yeah, so they're using force to make the physician go through this stressful exercise to provide just basic care for Medicare patients.
Well, a good example is the shortened lifespan. Doctors in America, male doctors, average lifespan, if I remember correctly, is only around 55.
Their life is terrible.
If you live longer than 55, you are on borrowed time, Doc. So if you're 56 or 57, you've had 2 more years than your allotted average male doctor in America because of the freaking crazy stress. And by the way, it's not bleeding patients or sick patients or dying patients that are stressful, because when you provide compassion, it buoys you up. It's these damned regulators. It's the threat of bankruptcy, jail, everything. It's the incredible crush of trying to keep an office open and running around like a gerbil in a cage. And with Obamacare, it'll be so much worse. I just literally see a lot of doctors that are around my age that have got a lot of training and experience. They'll just say, to hell with it. I'm quitting. I'm going to go to Costa Rica. I can't.
Well, then they'll do like Canada, which makes it illegal to quit medical practice. It's all illegal for quitting a profession. So even if the doctor becomes so dispirited, he wants to retire and quit early, they say you can't.
Well, you know, the thing is that I see society as ripping apart. I see this as the final, when I see this kind of thing from Easy Kill manually, and I see this from the Obama lying administration, this is the most vile, gross, evil, conniving, sneaky, horrifying administration that's ever walked the face of the earth. And what they're planning is even more in your face than the Nazi Germans did with their killing, according to the Journal of the American Medical Association, 275,000 disabled people before they killed the first Jew, Slav, black, homosexual, or anyone else that's an undesirable. They will want to kill the weak, the disabled, the elderly, the people with serious burns or injury or trauma or a terminal condition. Rather than help them, they're going to help them into the grave.
Well, that's true. And, you know, when I tell people that, yes, it was true what you're hearing, that they want to speed the death of the elderly, the chronically ill, and the disabled, they all shock themselves. I just don't believe there's people that would do that. Well, as I quote in my paper, according to the British Healthcare Commission, their own commission, found that between 400 and 1,200 people had died as a result of what they characterized as appalling care at hospitals in Staffordshire. That's one city in Britain.
Yeah.
400 to 1,200 people had died needlessly. Now multiply that times 100 cities.
Well, let's back up a bit here. There is euthanasia in America. There is some euthanasia where you run out of insurance and you're not given the extra time on a ventilator. Back in 1997, I took over the practice of 4 general internists at the Swedish hospital, doing a locum for more than a year. And what happened is that I get very working in the ICU as well. I get exposed to seeing situations that I found just mind-bending. One of the worst was a situation where a respiratory tech, I saw him taking out his pocket knife and cutting notches in a respirator. I said, "What are you doing?" And I said, "I'll bet that's your pearl handle." And he says, "You're pretty smart." And I said, "What the heck are you doing?" I said, "I just pulled it from Mr. Such and Such because his insurance ran out." And, of course, I had already applied to go over to work at Vencor, Ventilation Corporation of America, to do work over there. And Vencor, of course, if you get an additional 90 days of ventilation therapy for people that would otherwise be pulled, 85% survive, and only 15% are ventilator dependent. That means if you don't get the additional care, you die. Okay?
Right.
Now, this is what's going to happen, people. And if you don't know what goes on in hospitals every night, and if you think it's bad in Britain, it's also horrifying in Canada. My wife was the director of the Down Syndrome Society for Nova Scotia because I have a daughter that's 16 and a half with Down syndrome. And they denied 2 medical doctors even moving to Canada to provide rural practice because they had children with Down syndrome that didn't even need heart surgery, didn't need advanced care, didn't have any serious medical problems. They don't want disabled people to move to Canada. And if you do have a child that has a genetic defect, they try to force the parents to abort the child. It doesn't matter if you're pro-life, you're Christian, you're Muslim, whatever, and you don't want to abort your child. They will harass you. And they harassed me, even though I'm pro-life, 17 years ago, and I had to eventually tell off the geneticist who just happened to be Jewish by name, certainly not by his behavior. And I said, if he was calling me as early as 6:15 in the morning and 11 at night, I said, you need to get down on your knees to the God of Abraham, Isaac, and Jacob and repent of trying to tell me to kill my child, because if my child survives, she will have the heart surgery, which she did at 6 months, and she had heart surgery again at 2.5, and she's never had a heart drug since. She's in perfect health, never had anything more than a 4-day admission for RSV something like 5 years ago, and otherwise has never even had a bad cold. This is an obscenity, and what we have here is with Easy Kill and with Canada, they want to unify with Canada. That's why they want to harmonize with Canada. Canada is horrendous. They kill patients every night in the hospital. They literally go through like the angel of death with lethal syringes and policies of withdrawing care and giving narcotics only and not treating infections. It's just disgusting. The Canadian healthcare system is an obscenity. No new advancements, murder by proxy. It's unbelievable how they try to push the families into killing their parents or anybody in the family who's sick or has any illness that could be addressed, but they don't. That's what you want, people. You want Canadian-style healthcare? God help you, literally. Back in a moment with more with Russell Blaylock. Welcome back, and of course these town hall meetings, people have only, if they have a little rage after they read this paper that you've written, Dr. Blaylock, they will be completely out of their mind, insanely enraged by this unbelievable obscenity called the health bills and pieces that Obama and his wackos, his Nazi killers, want to instill in America, destroying the good and the bad. They're destroying the ethics of physicians, destroying the real future of an advancing healthcare system where people should have medical tourism to America, not away from America. I can see that people that have the money will go to Taiwan or Japan or Mexico or Cuba or somewhere else where this kind of Nazi healthcare is rampant. People who just say, I've got to get out of here.
Yeah, the public has no idea how horrible this is going to be. They have no idea what has been discussed. And when I tell people, I said, the advantage I have over a lot of listeners, particularly people that don't follow things and read, is that I've read what these people have said. These are policymakers. This isn't some nut job sitting in a coffee house in New York. These are policymakers. These are powerful people. They have for years of their dream of the society they want to create.
Right.
They have talked about, written about the necessity of getting rid of people with chronic diseases, people who are elderly toward the end of life who are costing us a lot of money.
Well, look at the health czar. The health czar that he has besides Easy Kill. Here's another eugenicist that wants to reduce the population by any means, and no matter how gross it appears even on the face, and yet they'll smile at you and say they're going to give you health care. It's just obscene.
Oh, it is. And you know, I give several examples in here, as you say. For instance, the example of the elderly man, I said 70s, but I think he was in the 80s, but he was confined to his house because he had cataracts. He went to this ophthalmologic surgeon and said, what can you do for him? And he said, well, we can fix your cataracts, and you can see. He fixed the man's cataracts. The man could see perfectly, started going out, playing golf, enjoying his life. Well, there was this ophthalmologist in competition with him who turned him into the government because there's a system of turning in doctors who are recalcitrant. And so he was brought up to charges of abusing a Medicare patient. The abuse was giving the man his sight.
Oh, my gosh.
And so he was convicted and given 10 years in prison, federal prison.
Oh, my gosh.
And to make it worse, he was a young guy. He had a family of 4 or 5 small children. They not only put him in prison, but they moved him from a California prison where his family lived all the way to the eastern seaboard so they could get him as far away from his family as possible.
Oh, no.
Just to rub it in his wound, salt in the wound. I spoke to his wife. This has been written up in the Journal of American Physicians and Surgeons, the entire case. So this is the extent these people will go to make sure that people don't get health care. Now, you think, what compassionate government would deny an elderly man his vision? I mean, he wasn't crippled in any other way. He just couldn't see.
Yeah,
now he can see.
Yeah, and it's not that long a procedure. I mean, I've done locums and assisted in eye surgery. It's a simple procedure. It takes about 30 to 35 minutes. It's really no big deal at all. It's actually
and it's relatively inexpensive.
Yeah, it's actually inexpensive surgery. It's not, and even the stupid numbers and the lies that Obama is telling, it's just like he needs to have a good slap. We have here, for example, I'm talking about unscrupulous physicians charging $45,000. You quote in your article, which is just a damn lie. I mean,
sure.
This isn't the case. Period.
Well, it turns out that they got $750.
Yeah, exactly.
That's a far cry from $45,000 to $50,000.
Yeah.
But you see, the public is inundated with these lies, and they're thinking, oh, how unconscionable that this doctor charges $50,000 to take a man's legs off. He's just ripping off the taxpayer.
Yeah.
When, in fact, it wasn't true at all. The story was a concocted lie.
I talked the other day to a orthopedic surgeon in Aurora, Colorado, who realized that after 30 years in practice, he was making $45 an hour and working literally 7 days a week, in and out of the hospital and running around and doing these things. And his health was starting to go with all this stress. And he realized with the billing, people being charged $35 an hour and everything else, he couldn't keep up the pace. So if he backed off a little bit, he was going to lose his practice and his income and would go completely under. And, of course, what happens, doctors, because they're working so hard, they can't save enough money. They get very few vacations. They're dying prematurely, and they don't even have pensions. There's no guarantee from the government. And the same, by the way, in Canada. It's not a publicly run system where your doctor, if he gets old or sick or whatever, gets a pension. No. He gets kicked aside. He gets nothing, and yet all of the expenses, including a building and office equipment, the doctor has to pay. The doctor has to get the loan. Then he has to cry to the government to get these measly little fees, and then tries to not get into trouble while being compassionate and providing care to people, that if he violates these new regulations, and by the way, they do it in Canada too, these protocols, if you violate the regulations under Obama, you're going to the big house. You're going to lose everything. You're going to not see your family again. You're going to die prematurely in a prison cell.
Well, look at the abuse of the Medicare system. Doctors regularly were being audited, and they would come into their office, sometimes with men with guns and dressed in black, during the office hours.
Oh, yeah, I saw that.
Their patients. They would confiscate all the records in their office, whether they're Medicare or Medicaid, and then they would hold them for months and months. Well, the guy couldn't make any money. He doesn't have any records. And then they would come back and say, you owe the federal government $475,000. We went through your records for 20 years, and we think that you overcharged these patients for 20 years.
Oh, my gosh.
And so here the doctor suddenly has to come up with $428,000.
Which you can't do.
You see, and he tried to follow everything they said, but now they changed the rules and said, well, with the new rules, you were in violation back then. And so we're auditing everything, and you're going to jail, or you have to come up with $420,000. This happened all the time.
Oh, yeah, I saw it. I was actually in an office where an older physician was there. Luckily, the guy had connections to the state senator, and he raised all hell. But they came into the office with dogs barking, 100-plus pound German Shepherds, guys with flak jackets, AR-70 machine guns, helmets and everything back in the late 80s. And when he called the state senator, he ripped a strip. Let me tell you, those guys went hightailing it out of there. But not after. They terrified the staff and everybody else and literally had everybody leaning on the walls and patting people down.
And that's patients.
Yeah, with patients in the room that could have a heart attack from the stress of just seeing their doctor assaulted by these idiots.
Oh, yeah. I mean, it's become Gestapo tactics. And unfortunately, the media doesn't carry these stories. You find them in the newspapers. And so the general public doesn't even know this occurred.
Of course not. And here's the problem. The public has no idea that hospitals they want to convert to killing centers. It'll be no different than Soylent Green. It's just it's so evil. And then when I hear every single word of anybody in Obama's cabinet and anybody affiliated with him is just like right out of the psychopathic killer ward that should be in lockdown in a posy in a padded room. These people are nuts.
Well, they jumped all over Sarah Palin for saying there were going to be death panels. If you read this bill, there's provisions for end-of-life counseling. And in it, it's part of the practice of medicine is the counseling. So everybody will be counseled. Now, they said it's not mandatory, but everyone will be subjected to it because the patient doesn't know any different. And here's what it says in Section E. The practitioner of the continuum of end-of-life services and supports available, including palliative care and hospice, benefits for services and supports under this title. The reasons why the development of such an order is beneficial to the individual and the individual's family, and the reasons why such an order would be updated periodically as the health of the individual changes. And what that means to physicians who have dealt with this day in and day out is that you're to advise your patient to prepare for the end of life, that they're no longer going to get medical treatment.
Right. And we're not talking about you're in the ICU because of this or that, and then you just use ordinary common sense and logic. No, they're talking about years in advance, every 5 years, telling people, guess what? If you get sick, we're not going to be there for you. That's what Obamacare is. God help us, literally. End this government. We need to stop it now. This is evil beyond evil. We are literally dealing with the Omega president and, of course, easy kill manually. And the Hastings Institute and the Science Czar, another monster. Amazing analysis. Read that paper. Thank you, Dr. Russell Blaylock. Your analysis is frightening but true. Back in a moment with our Health and Wellness Hour in Hour 3. You don't want to miss it. Mark Lerner and the PASS Act Real ID coming.